Hi, I'm going to be talking about osteogenesis imperfecta, also known as brittle bone disease. I'm also going to be sharing this pictured mnemonic to help you remember key points about osteogenesis imperfecta. You may or may not see a question on this topic on the boards. Either way, it's an easy topic to remember the key points. So, osteogenesis imperfecta, the most common form is autosomal dominant with an abnormal type 1 collagen, type 1. Osteogenesis imperfecta causes multiple fractures, so you may see patients that come in with multiple fractures due to minimal trauma, a blue sclera, which is due to the translucency of the connective tissue over the choroidal veins. Hearing loss is something that these patients have, and that is due to abnormal middle ear bones. And commonly, these patients would have dental imperfections due to the lack of dentin. Be careful to read the entire stem of the question because these patients can be commonly mixed up for patients that are undergoing child abuse. And lastly, on the test, you may see this condition described as a defective bone matrix formation problem, or you may see it described as a problem with triple helix formation. Type 1 again is the most common type, and type 2 is usually in utero and is fatal. If you found this video helpful, please subscribe and comment below, and also give me recommendations on future videos. Thanks.